many countries in sub-Saharan Africa is undergoing a rapid epidemiological transition in their disease pattern. What we call non-communicable diseases are now overtaking the communicable diseases. Communicable diseases like typhoid, malaria, and so on are being overtaken by the non-communicable diseases. So the non-communicable diseases are now becoming the major causes of morbidity and mortality. Among the non-communicable diseases, which include what we call cardiovascular diseases, diseases that affect the heart and the blood vessels, cancers, or what we call the malignancies, chronic obstructive pulmonary disease like bronchitis, like emphysema, those ones affect the lung, diabetes mellitus, whereby there is too much sugar in the blood system because that chemical substance called insulin is not working very well. Either it is deficient or it is present and it's not working well. And also sickle cell disease. Among these, the cardiovascular diseases stand out as the leading cause of death in Nigeria. Cardiovascular diseases, which include heart attack, what we call ischemic heart disease medically, heart failure, in which case a heart is not able to work very well, and if it's going to work at all to supply the various organs in the body to be working under stress, and stroke. These have become a major public health issue, accounting for approximately 10 to 11% of total annual deaths in our beloved country. There's been a significant rise in cardiovascular disease cases over the last 2 decades. In fact, it has been a very, very steep rise. And they now represent a major cause of medical ward admissions. So in our medical wards, at each time, you will see that up to 20 to 30% of the cases are cardiovascular diseases, and even hospital mortality in up to 30 to 40% of cases. So what are the causes of these cardiovascular diseases in Nigeria? The number one cause is hypertension. Hypertension affects over 20 to 30% of Nigerians and is a primary risk factor for cardiovascular diseases, which include stroke, heart failure, heart attacks, and even chronic kidney disease. The body is made worse by lack of awareness. It is said that over 29% of people that are hypertensive in Nigeria are not aware that they have the condition. Why? Because they don't check their blood pressures. Now, among those who are even aware, only 23% receive treatment, and it's because of different reasons. Either because some will claim ignorance, they don't want to receive treatment, or because they don't even have access to the medications. And only 12% of those that are treated even achieve their blood pressure control. When we say blood pressure control, we mean a blood pressure that is less than 140 over 90 millimeters of mercury. When the blood pressure is measured, we have 2 values. The upper value, we call it systolic, and the lower value, we call it diastolic. And it has to be less than 140 systolic and less than 90 diastolic. Now, this rise is driven by several factors. There are several factors that is causing the burden of hypertension to be so high in our society. One of them is high intake of salt. Our food is becoming very salty because we are depending so much on processed food, which contains a lot of salt in most occasions, because they have to be salted to be preserved. That's one thing that happens with processed food. In the research we carried out with other institutions through what we call the Nigerian Sodium Study, and the Nigerian Sodium Study comprise University of Abuja researchers, the researchers from Washington University in St. Louis in the US, the researchers from Northwestern University in Chicago, and also researchers from what we call the George Institute, University of New South Wales in Australia. We found out that on the average, Nigerians are consuming, that is daily, each person about 3.8 grams of sodium, which is far above what is recommended by the World Health Organization. The World Health Organization recommends about 2 grams, and we are consuming 3.8, which is about twice that. And so this is one of the main drivers of high blood pressure. Other drivers include sedentary lifestyle and obesity. And obesity also is related to what we eat. The more of the calories you take, the greater the tendency to add weight. And most of these calories come from ultra-processed food, like sodas. The second cause, or major causes of cardiovascular disease in Nigeria are obesity and diabetes mellitus. You cannot separate both of them. Diabetes and obesity are two closely linked risk factors that drive cardiovascular disease in Nigeria. It is said that about 5.8% of Nigerians are living with diabetes mellitus. The rise in this condition is fueled by excessive take, of food that are very, very high in calorie, and in addition to physical inactivity, we are becoming less active, unlike our grandparents and great-grandparents that went to the farm, rode bicycle, walked to the farm, and burnt out a lot of calories, and even ate better food than we are eating today. Many of these calories are from ultra-processed foods, such as sugary sodas. We call it soft drink, the US, they call it sodas. Energy drinks have become the delight of some people now, especially the young ones. Packed snacks, the chips, the cookies, the convenience meals like frozen pizza, instant noodles, and processed meats like nuggets, sausages, and hot dogs, which were before this time alien to us. But with westernization, they are coming in a lot of fast food joints now, and these, give access, make it possible for people to easily pick this food, which are really ultra processed food. The other major cause of cardiovascular diseases is what we call high cholesterol in the blood. Medically, we call it dyslipidemia. Cholesterol is high. When we say high cholesterol, high bad cholesterol, because there's also the good cholesterol. The bad cholesterol, number one, is what we call total cholesterol, and the second one is low density lipoprotein, LDL cholesterol. The dyslipidemia is equivalent to high bad cholesterol, and it's a major contributor to heart attack in our environment, or what we call ischemic heart disease, and also stroke. Elevated cholesterol level cause injury to the walls of the blood vessel that supply the brain and the heart,